Welcome to the Han House podcast. I'm Hutch, your host, and my co-host Sean will be on in just a few minutes. So stick around for a great episode. We have a great episode coming. We're going to talk about health. We're going to talk about society. We're going to talk about medicine. We're going to talk about longevity. We're going to talk about religion and spirituality. So stick around. This is going to be a great one, and you're going to want to hear it. Plus, we have an exclusive interview with Sean's grandma, and I can't wait for you guys to hear it. So here we go. Back in a sec.
Grandma, say your name.
Eileen Decolante.
Before we get back to the interview, let me just give a quick overview. Today we're going to be talking about the importance of spirituality and religious belief in healthcare and medicine. We're going to specifically touch on these concepts as social determinants of health, how religion gives patients meaning during illness, and some reasons why providers should engage in productive discussions around spirituality with their patients. And Sean's grandma provided us with a really eye-opening personal account of how her religious belief helped her throughout her breast cancer diagnosis and treatment. First, given this is the first episode, I wanted to introduce a bit about how the Han House name came to be. So Sean and I were both actually in Han House first year at the Woodlawn Residential Commons dorm hall at UChicago, but it didn't occur to me until just a couple days ago that combining the first letter of Hutch and the last two letters of Sean, you get Han. So we thought that this was a fitting name, and we're so excited to be starting this podcast off strong. Also, we wanted to give a quick disclaimer that Sean and I are both Catholic, but I believe that a lot of the benefits of religion and spirituality that we find in the literature can be generalizable to many religions, and that almost anyone can learn something from Sean's grandma's experience, also as a Catholic. We also wanted to note that we got full informed consent from Lean for this interview, and that we consulted the McGill Illness Narrative interview questions to help us with the interview. Anyway, Sean, take it away. Who is your grandma?
Thank you for this incredible introduction, Hutch. So my grandma, Eileen Decolante, is probably my favorite person in the world. An introduction to health and society actually gave me the opportunity to interview her about her experience with breast cancer. My grandma kept her diagnosis a secret for a long time, and this was actually the first time I ever spoke with her about this notable period of her life.
I had a regular mammogram like I always do, and then usually a couple of weeks later they send you a thing and you don't even look at it because like, oh, you're fine.
Yeah.
See you next year.
Well, how old were you?
Well, it was 16 years ago, so I was 63.
Okay.
And so I got the letter and I just go to open it, and then I was like, whoa. This says, we saw something, you need to come for another ultrasound. So I did. The thing of it was, at the very same time, my sister had just been diagnosed with lung cancer. So we both were, and it was just like, okay, I don't think I want to hear this one, because she had just been diagnosed with lung cancer, which had metastasized already to her brain.
So my grandma, some of her background is she was born and raised in Chicago, and she's the third of 7 children. So she's been a caretaker since being very young. Her father also fought in World War II and was awarded the Purple Heart because an explosion blew his arm off in Italy. So she dealt with disability, and she dealt with raising her siblings as children, and other, disability, illness, and other difficulties that popped up in life. She grew up Catholic and actually became a nun for a short period of time before she decided that it wasn't the right vocation for her. She ended up having 4 children, one of which is my mother, and 8 grandchildren. But when she learned that she had breast cancer, she did not share the news with any of them. Mainly so they wouldn't waste time worrying about her. She was always thinking of others. So for her diagnosis, she just went in, got a regular mammogram, but it came back with questionable results. It wasn't just the normal, like, oh, okay, you're all right. So she secretly went into the doctor, and the day of, my dad had called her because she was supposed to pick me up from school. but she took the L into the city and got it checked out and said, "Don't worry, I'll be there. Just run a little bit late." She was worried because she had some family history of cancer, with her sister being diagnosed prior and many other people with heart disease and other various forms of cancer. And she had one lump actually removed as a cyst, but the second lump was diagnosed as stage 1 cancer. She was lucky and very glad she caught it early, and she'd figured that it was going to be a pretty quick process by the way the doctors talked about it. On her way home on the L, before she picked me up, there was a priest in the train car with her. And right before she got off the train, she asked the priest on the L to pray for her. She saw this as a sign from God, pretty much telling her that everything's going to be all right, that she should just keep the faith, and she'll be perfectly perfect after the procedure on the other side. She was going through her cancer at the same time her sister was diagnosed with lung cancer. So Mary had already gotten a mastectomy and beaten breast cancer, but she had just been diagnosed with lung cancer. And faith was extremely important to that period of her life for her, for her sister, and it still is important to her. The day of the procedure, she had told her kids prior that she had cancer, but she went down with my mother and my Uncle Matthew to this Northwestern doctor that she had heard about on Channel 11 News. She spoke well, she did everything right, and my grandma contacted this woman to help her. She got a full mastectomy, even though she didn't need it, but she took advice from her sister Mary, who had said, just make it a quick fix and don't need to worry about it later. She was back home in less than 2 days, and she took prescribed medicine every day for 5 years, but she didn't have to go through chemotherapy or any other harsher treatments. She showed me the picture during this interview, actually, from the time period that I remember, when all of her children and grandchildren took a picture around Christmas with her, and it was like 2 days after she got the mastectomy, which was crazy to me at the time because I couldn't think of her having just gone through this crazy process, because I just saw her as my normal grandma on a normal day. But she had no scares post-operation. She gained so much empathy from the experience that she kept noting over and over in the interview for old people who went their whole lives without cancer and then suddenly had this attack them, for young people who had so much more to live for people with many dependents like mothers and fathers and whatever, but then others who are lonely and don't have support around them. She gained empathy for people who were going through anything more harsh than she was going through. And then the people who were really scared. She was never scared because she always kept the faith. Some perspective change she had through this experience was really understanding that research and funding for this research is needed to combat cancer and other illnesses. She also had an experience with insurance where she ended up asking, if you don't have money, do you just die? She thought it was kind of crazy that she had to go through all these loopholes to just get this cancer removed from her. But she continued to emphasize how her faith, prayer, and science in her life kept her calm and gave her the courage to offer up her suffering for others, especially Mary, her sister, and the others in her life who were suffering. She continued to have experience as a caretaker, obviously starting in her youth, helping her siblings and parents, but then throughout her life she's been a Eucharistic minister for many people who can't make it to Mass on Sundays and give them communion, many who have been bedridden but have lived over 100 years old. And then her next door neighbor Florence died a few weeks ago, and she was, I think, 106. Her sister Mary she took care of through breast cancer and lung cancer, and her brother Tom now has bipolar disorder and many other things wrong with him. Her son Johnny had almost died 2 years ago, and she took him into her home and nursed him back to health. She spent time after retirement volunteering at the Resurrection Hospital near our house just to talk to people who were going through sufferings and who had family members in the hospital. And her whole life, she's just been someone that people talk to and give their troubles, and she's acted as a therapist and just another ear, another helpful, smiling face that attracts anyone who is suffering. So from our 45-minute interview with her, here are a few selected clips of what my grandma had to say about her experience and about her faith.
like I said, I didn't tell anybody. But it just happened to be sitting right next to a priest on the L.
Okay.
And he's got his little book reading. And when I got off of it, I just said, say a prayer for me, Father. And he said, okay. Everybody was always positive about things.
That's good.
So, yeah. So I never was afraid.
You stayed positive.
Yeah, I stayed positive
Yeah.
because they were positive. And I was, thank God, I've been fine. No problems since. I remember one time sitting, just waiting for the results of something, and there was a young girl there, and she was young, and she was so afraid. So afraid. She just talked and talked and talked. And I just listened and just said, I will pray for you. And I said, you'll be fine. And some people, you got to hear that. You got to hear, it's going to be okay. You're going to be okay.
Yeah.
But she was just terrified. And that's a horrible. And again, people who listened and were just supportive. I think you just need people who will be there to listen, and people to be supportive, and people to be that second pair of ears when you go to a doctor.
Totally.
You just, because you're all over the place,
Mm-hmm.
and you need somebody who's isn't. And Sharon was that for me. I think you just have more empathy for other people who go through that.
You've already talked about it a bunch, but how has your spiritual life, faith, religious practice helped you go through the period of your life?
That's just a part of my life, is my religion and my faith. I just put my faith in God, and every day, that's the first thing I do when I wake up in the morning is pray. And it just keeps me going. I feel bad for people who don't have any faith. It's, again, to each his own, but it's definitely who I am. It makes my life better. I'm glad I had my faith. It does make a difference to me. Then, my chances of ever getting cancer again were just like the general population.
Okay.
Again, so I never stressed over it. And again, spiritually, just going through it, I pray and I offer up for others. So it's always a part of me, no matter what I do.
Really inspiring. That's awesome. Thanks, Sean, for sharing all of that. And thank you to your grandma for her perspective and her wise words. That must have been so hard on her, but it seems like she has a really great outlook on life and great people around her to support her. So now I just want to ask, what's a social determinant of health?
So social determinant of health, sometimes called social drivers of health, are the non-medical, everyday conditions where people are born, live, learn, work, and their age significantly shape their health, their functioning, and their quality of life. One of our readings, titled Social Conditions as Fundamental Causes of Disease, by Bruce G. Link and Joe Phelan in 1995, sought to put epidemiological, I should have really figured that out before we did this, epidemiological individual level risk factors like smoking, drug use, obesity into a social context. They argued that, quote, social factors such as socioeconomic status and social support are likely fundamental causes of disease that, because they embody access to important resources, affect multiple disease outcomes through multiple mechanisms and consequently maintain an association with disease even when intervening mechanisms change, end quote. The 5 major social determinants of health are economic stability, including poverty, food security, and housing; education access and quality, including learning opportunities and literacy; healthcare access and quality, which includes insurance, other providers, and screenings; neighborhood and building environment, which includes safety, green spaces, pollution; and then social and community context, social support, discrimination, and civic engagement. We believe that spirituality and religion are also social determinants or social drivers of health, and that they would probably fit into the last category of one's social and community context. So Hutch, can you explain a little bit about how spirituality and religion can be social determinants of health?
Well, certain religious groups tend toward certain behaviors based on their culture and or their teachings. For example, as briefly mentioned in the Lincoln Phelan article, quote, certain religious groups such as Mormons and Seventh-day Adventists have lower risks of some types of cancer, end quote. This is generally thought to come from the fact that these two groups teach abstinence from drinking alcohol, using tobacco, or using other recreational drugs. And this accords with other research by the Pew Research Center, which says that the religiously active more generally tend to smoke and drink less. And this has great effects on individual health and really striking effects on population health as well. Well, what do the statistics say about overall health? Does religion move the needle? Well, we found that the statistics say that being religious and or spiritual improves your health and longevity. Epidemiologist Dr. Tyler Vanderweel of Harvard has done a considerable amount of research in this field. He followed thousands of participants longitudinally and found that over a 15 to 20 year period, religious participation cuts all-cause mortality by 30%, cuts death due to cancer and cardiovascular disease by 25%, reduces anxiety and depression, increases one's sense of meaning and feeling that their life is flourishing. And this was a longitudinal study rather than a cross-sectional study, which reduces the likelihood that the causation just goes the other way around. Further, other studies show that those who are religious live for 4 years longer than on average when controlling for sex and marital status, with some studies putting that figure even higher at 6 or even 9.5 years. The reasons behind this are many: behavior, social ties, psychological well-being, mental health, and meaning. But the research shows that it's not just a sense of community, but that it goes a lot deeper than that. But Sean, what's the difference between spirituality and religion? What did you find? Is there a difference?
They are very similar, but there are certain differences. So today we're seeing that fewer people are religious. We've seen that church membership among U.S. adults dropped below 50% for the first time in 2020, coming down from 70% in 2000. Meanwhile, we've seen an increase in those who claim to be unaffiliated or spiritual but not religious. So I think that for a lot of people, this is an important distinction. I'd say that religion is associated with certain requirements for membership, structure, ritual, beliefs, sacred texts, and community. However, being spiritual is more of a personal quest for meaning and purpose. Often, people report feeling connected to something greater. They might be agnostic, so they don't know if God exists, and oftentimes they might engage in spiritual practices like meditation. In a lot of the papers we looked at, we found that people tended to lump these two groups together, spirituality and religion. And a lot of people are both, but they don't have to be. On their health benefits individually, though, there's a couple schools of thought. Some believe that religion can be too structured and rigid to allow for personal exploration, and that this can be detrimental, possibly to mental health. Possibly to mental health if you agonize over sin and rules too much. But that being said, many others believe that community you gain through religion is important, and that rigid rules might promote healthy living. We're also seeing a somewhat encouraging resurgence among young people towards the older, more structured religions like Catholicism and Orthodox Christianity, and some speculate that this is because people want more meaning in their lives, and they want to connect with those that came before them, especially with these old religions steeped in tradition.
That's super interesting. Yeah, I recently listened to a podcast by Andrew Huberman, a neuroscience professor at Stanford University School of Medicine, who interviewed Dr. David DeSteno, who is a professor of psychology at Northeastern University. And he had a really interesting perspective on this. He talked about how the evidence that we're seeing of how religion and spirituality can improve your life and your health, whether making you less lonely, less stressed, more honest, more compassionate, makes it almost the rational choice. He argued that it's the wrong question of does God exist, because scientifically we can't prove it, and we also can't disprove it. So what's essentially important and what you can measure is what are the effects of religion in the here and now for those that follow it. And so that's what he mainly focused on in the podcast episode that I listened to. There were a lot of interesting points that I'll just touch on briefly. He talked about how prayer acts as meditation. It can make you think about what's important in your life, increase your gratitude, slow your breathing, and calm down your nervous system through the vagus nerve. So that being said, if I'm a doctor, I can't prescribe you religion, but that would be unethical. But what can I do?
That's right. But I think there's still a lot that can be done. The research shows that there are patients out there that want to have these kinds of conversations with their doctors, not with chaplains, at least in some way or another, and not just for those near the end of their life or dealing with terminal diagnoses. Research from the University of Michigan, which used a nationally representative household survey conducted exclusively by NORC at the University of Chicago, found that most adults, 84% of them, from 50 to 80, said that religious and or spiritual beliefs are important to them. And of these, 70% reported feeling comfortable discussing their beliefs with their healthcare providers, although there were still many who weren't very comfortable being asked outright if they're or about their religious beliefs. I think the article Spirituality as a Determinant of Health, Emerging Policies, Practices, and Systems provides a really great answer to this question. So if religion and or spirituality is the driver of health, what do we do now? They provided some great recommendations and evidence of what works. First, they found that greater infrastructure to connected hospitalized congregation members with volunteer-trained health ministers provided valuable results, such as longer time to readmission and lower gross mortality rates. Further, another program found success by engaging congregations using volunteer connectors to link patients to local medical centers, which ended up saving charity money in the long term. Then they found that simple questionnaires could be used to find who to target for spiritual support, and that answering these questions could result in fewer depressive symptoms and a stronger sense of interpersonal caring from their physicians. They also argued that there's a serious need for more chaplains and greater utilization of clinical chaplaincy, and also the need for more practitioners trained in how to provide spiritual care or at least engage with patients on their spirituality. They also recommended that spirituality in healthcare should continue to be researched to a greater degree.
So how did religion impact your grandma's health journey then?
I think there are a bunch of ways that religion had an effect on her health journey. I think that for her, she was able to use prayer as a way of meditation, a way to calm herself down, to slow her breathing, put her in a better mental headspace, like you talked about, which obviously is associated with better mental health. I also think that she had a great network, which was very socially connected with her friends and family, which totally came from her empathy and compassion for others that she talked about. She also had a community at church that she would see all the time and get to communicate with regularly. She worked as a Eucharistic minister and was always there for strangers and her family, and I think that because of this, others were there for her and helped to stabilize her mood too. She lived a clean lifestyle, and I think that all of these factors together helped her through her journey. We see that religion has similar effects like this for many people. For example, we see that in one of our readings by Jenny Trinitapioli, where she studied uncertainty in the context of HIV diagnosis in Africa, and found that religion can reduce a general feeling of uncertainty. Although this is very different context from my grandma's health scare, I think that you can definitely draw some parallels.
It really seems to me that your grandma has had healthy relationships with those around her, has been there for others, and others have been there for her. She seems to have dealt with her illness very well, whether that's just her ability to deal with hardship or whether it's influenced by her religion. It really seems like she has a super solid mental foundation and a lot of meaning in her life. I feel like that's something that one of our readings this quarter touched on as well. The Illness Narratives, Suffering, Healing, and the Human Connection, written in 1988 by Arthur Kleinman, discusses the subjective experience of illness and emphasizes how a patient makes sense of their illness and comes to give it meaning. It makes one of the biggest pushes for physicians to care for the whole person and not just the body. Within the text, it is the fourth meaning of illness that he discusses, I feel, that is incredibly important, and it is... This meaning of illness is called the explanation and emotion as meaning. He essentially says that illness can teach you how to live and it can help you develop emotionally. It seems like religion, at least to me, is a way of finding meaning and placing an event like a health scare in the context of your life. It can help you deal with the emotions that a scare like this can produce and can help you move forward, and it seems like your grandma has done that really well.
I also think she's gone through this incredibly well, and she really told the story in a great way. It seems like she was able to use her religious faith in the right way in order to get through tough times and to care for others, but still not use it as a crutch or to overuse it. It's really interesting to consider how many aspects of our lives are touched by our religion or our spirituality.
While we didn't have a full unit on religion and spirituality, it seems to often reveal itself in different aspects of the texts throughout the class. In one of the readings on brain death and organ transplantation, we learned how the Catholic Church had a say on when death was and we also saw how important spiritual thinking was to the questions of how death was dealt with in the hospital by the family and by the staff across cultures in Japan and also in the US. We also saw in the Jenny Trinitopoli reading that traditional authorities like chiefs and religious leaders could be a force for good in Africa and often helped to get their communities tested for HIV to reduce the spread. However, I don't want to come off as thinking that religion is always good. There have been many scandals, even in the Catholic Church. Further, the Catholic Church was shown as an antagonist in the AIDS documentary that we watched, How to Survive a Plague, where those in the church advocated against condom use. Further, in another article, religion was a significant source of worry among those that sold their kidneys in Bangladesh, where they thought God would be displeased about their actions. Further, the illness narratives by Arthur Kleinman, using an example of a woman with debilitating chronic diabetes, and uses her individualist Calvinist upbringing to somewhat explain her delay in seeking help from medical professionals. Still, altogether, considering all of the evidence, it would seem that those who are religious actually still do better in terms of seeking care. It was shown that marriage and religion, proxies for social connection, have been linked to earlier cancer diagnoses and better outcomes. Married colon cancer patients have better 5-year survival rates than unmarried patients. And we think this might be because when you have this social network around you, people are going to notice if your health is, doing worse, and they're going to give you advice and, help you to get the help that you need.
So just to touch on spirituality and religion, kind of differentiate it again. We think that religion holds spiritual aspects, but there are also aspects of religion that are healthy that are not necessarily spiritual. So the spiritual things that we've touched on already about religion are that prayer is like meditation, and we know that meditation has many positive health effects. And then to be spiritual, you want a healthy mind, a healthy body. Think of the body as a temple and life as a gift. That is a great structure and great framing of life to make someone more healthy. And then, like Hutch had talked about earlier, lots of spirituality beliefs don't think that smoking or drinking or other drug use is really good for the body or for health. And spirituality also helps resist excessive human urges, like to not have too much lust or gluttony or wrath, other of the 7 deadly sins. It keeps people away from harming themselves and harming others. And then there's delayed gratification. That's part of spirituality. Fasting is an example. What's the word, Hutch?
It increases autophagy.
Yeah. Okay. Well, tell me about autophagy.
Yeah, so autophagy is where your body basically recycles your proteins, which decreases misfolded protein aggregation. And misfolded protein aggregation is actually what can cause aging and cancer. So when you're fasting, your body goes into this autophagy mode, which can actually be beneficial for your health.
That's just one example of the delayed gratification. Doing things that are hard early makes you feel even better later. So the healthy side of religion that we don't think is necessarily spiritual is that, belief in a higher power is spiritual, but then to have faith in a God who will save us is religious. And then, following the golden rule, treat others how you want to be treated, that makes the quality of life of the people around you in a religious setting so much better, because the care that you will receive is better than those who don't believe in treating others to the best of their ability. Then charity from religious communities, donations and volunteering works and helping the poor and whatnot improves the quality of life as well of others and gives meaning to people, which is helpful for them. And then having the shared community that Hutch has touched on plenty of times is unique to religion, I think. And having people to talk to is linked with longevity, being social, and then also having the people to check in on you, keep your health accountable, and help you out in any other way. So that was just a little breakdown of where we see spirituality and religion as being helpful in health.
Still, though, this is a really tough thing to, research and, look into, because religious belief is heterogeneous and it's very complex, and the research into its myriad effects are still not fully conclusive. Further, religiosity as measured by church attendance or identity is often easier to measure than the nebulous term of spirituality, a term that many might identify with even if they don't incorporate spiritual practices fully into their daily lives and routines, such as meditation, etc. However, it seems to us through our research into this topic that at least for religion, it's a tool like any other that can be used productively or destructively. While it can motivate terrible wars and terrorist attacks, we also know that religion has been a major aspect of medical care going back hundreds of years before modern scientific medicine, and that many hospitals were actually started by religious groups. I'll end the podcast with a quick story, something that I personally experienced that showed me the value of the spiritual element. I was volunteering at the Ronald McDonald House last spring. It's a house near Comer Children's Hospital in Hyde Park, where families of children at the hospital can stay free of charge in order to be close to their loved ones. And it's something that I really believe in because I also believe in the powerful healing effects of family, and I still continue to volunteer. But anyway, last spring, I spoke with Mark, a father staying at the house. He told me how his daughter had rolled over in her crib and stopped breathing for several minutes. She was rushed to UChicago Medicine and placed on life support. He even shared with me the impossible decision he had to make in deciding to keep his daughter on life support despite her condition. Mark talked at length about how his faith and his prayer guided him in this decision. He said that despite how devastating this experience had been, it reunited him with his significant other and the mother of his child, and he showed me a video of the two of them sharing their story at church. Although he was extremely thankful for the medical care his daughter received, he also wondered aloud whether his race affected how his daughter had been treated. His honesty and the weight of his story really touched me. Although, again, I didn't have all the answers, I was grateful that he entrusted his story with me and allowed me to support him during a difficult time. This story really showed me the impact of religion on healthcare and healthcare decisions, and really emphasizes to me how programs that encourage the discussion of spirituality with those who are willing, maybe just even in the passive way that I was able to talk to Mark, can be beneficial for people. In the ways that we've talked about here on this episode of the podcast, maybe we can really help people and treat the whole person by a focus on spirituality to a greater degree. For those like Aline Daculante, who might have dealt with a serious diagnosis, or young people who want to continue living a healthy lifestyle. As always, let us know any questions you have, if there's anything we left out, or what big questions you want us to tackle next. From me, Hutch, and from my co-host, Sean, thank you all for listening, and we hope to see you next time.
Adios.